Hey guys, Alex Chemarov here at Movements for Life. We're going to continue our way up the posterior chain, and our next stop are the hamstrings. A lot of dysfunction we see throughout the hamstring group, and it's related to so much head to toe, from what goes on at the foot and ankle due to its link with the calves and the plantar fascia, obviously at the hip and lower back, and making its way up, believe it or not, to the thoracic spine and to the cervical spine. So a big thing with a lot of hinging type patterns, I guess as a review it should be important to know, the hamstrings, I was taught years ago, anatomically speaking, it is a knee flexor, right? It will concentrically pull the knee into flexion, so it'll bend that knee, all right? And we've seen it at the gym so many times, seated hamstrings or prone, lying down. In function, it's very different, right? So we'll see it in our clients when they do hinge patterns. So a deadlift, for example, as the weight is pulling me down, my hamstrings are eccentrically, or should be, controlling my hip flexion. So at that point, the pelvis needs to be able to anterior tilt. I need to keep that arch as I'm deadlifting, and the hips need to shoot back, which is going to put a ton of load onto the hamstrings. When that doesn't take place at the hamstring level, then we see a bailout at the thoracic spine. So being able to give the hamstrings more length will help kind of unburden the chain there, if you will. In addition, the hamstrings are also, they can be thought of as reins. We do have three separate hamstrings. We have two on the medial side, and we have the bicep femoris, which is actually divided into two. So we do have, in a sense, 4 hamstrings per leg, and they act a lot like reins on the knee. So as the knee is driving into internal rotation, that bicep fem can kind of tug and hold on for dear life, versus if the knee's pulling laterally, then the medial hamstring group is going to become more active. So there is some independent action as well. It's not just the knee's not just a hinge. It doesn't just open and close like a door. There's so much more going on there. So to be able to attack the hamstrings from a soft tissue standpoint, we use a couple different tools. More aggressive, the lacrosse ball. If you're super sadistic, if you need something a little mellower, no tough guys here, or tough girls, it is okay to use a tennis ball as well. It depends on what you can tolerate and what you can relax, just like any other area that we're rolling. If it's too painful, you can create the exact opposite response. So you should be able to relax while you're doing it. So I like to position myself seated, and I do start above my knee at this point, all right? I don't want to start right behind the knee. There's all kinds of connective tissue, tendons, and gnarly stuff that you don't want to start rolling on. So I position the ball above the knee on the outer aspect of my hamstring, and I'm just going to kind of allow the weight of my leg to just sink into the ball, and I'm just going to kind of wiggle my leg around. I can go cross fiber with it, or I can kind of start moving a little forwards and backwards. I can even get a little pin and stretch technique by extending my knee and dorsiflexing my foot, which will start to put some nice tension on that hamstring, all right, depending on what you find. So I'm just going to systematically make my way up. I'm going to go up the bicep fem, and I'm going to go from knee to hip. For time purposes, obviously, I'm just going to accelerate this, but you're just going to make your way. I like to pick 3 lines, that outer line in between both, so in between the medial and the lateral hamstring. If there's some stickiness there where they both don't function independently, like those reins, then perhaps a little sticky hamstring. This can help clear it out for sure. And again, I'm going to make my way from knee all the way up to hip, and then return it back home. And you're going to start then on the medial side, on the inside. And you can make your way all the way up there as well. Take your time with this. This is definitely a little bit more of a relaxing one as a posture, because you are seated. Some of the other techniques to foam roll are not as comfortable. So this is really conducive. At home, if you have a coffee table, just don't do it with your parents around, because my mom and dad would yell if we ever sat at the table, or on the table, I should say. All right, so make your way up the hamstrings. These could definitely be really, really gnarly, but the benefit is definitely is huge. So as we like to say, the juice is worth the squeeze. So enjoy this one. Have fun with it. If you have any questions, don't hesitate to reach out. Thanks, guys.